Hello, I'm Dr. James Fingleton. I'm an asthma specialist based in Wellington, and I'm Medical Director of the Asthma and Respiratory Foundation. The Foundation have asked me to answer a few questions that people have sent in, so thanks for sending those in. Our first question is, what's the difference in a corticosteroid and an anabolic steroid? And that's a really good question because that causes quite a bit of confusion. So corticosteroids are the anti-inflammatory medicines that we use for asthma and other diseases. You'll be most familiar with them as the preventer inhalers, which is a very low dose of a corticosteroid that can help control asthma without causing many problems. Or as the steroid tablets such as prednisone, which people take when they're more severely unwell and have an asthma attack. Whereas anabolic steroids are testosterone and synthetic versions of testosterone, which are used sometimes to treat medical conditions, but also abused by people who are trying to bulk up in weightlifting or other power sports. And those are very different compounds. They're not the same at all. So the corticosteroids used for treating inflammatory conditions don't cause the same side effects that the anabolic steroids do. And in the inhalers, they don't really cause much in the way of side effects at all unless you're on very high doses. So they're very, very safe and very different medications. And the next question we have is someone's asking if they can't remember if they've taken their inhaled steroid, their preventer that day, is it okay to take an extra puff or should they just wait to the next day? And generally speaking, the answer is if you're not sure if you've taken it, one extra puff or two extra puffs is not going to cause you any harm at all. So if you're not sure, take it again. If you're regularly not sure whether you've taken it or not, then try and think about when you take your inhaler and see if there's something you can do to help you to be more sure. So can you do it at the same time that you clean your teeth every day, or can you set a reminder on your phone, or is there something else you can do to prompt you? But as a one-off, if you're not sure if you've taken the medicine, it's absolutely fine to take an extra puff or two. Next question is from someone who's had mild asthma for the last few years, last 10 years or so, but they don't use their preventer medication very regularly. And then when they get an infection and an exacerbation, they start taking their inhaler regularly, but they know that they then start to forget. And their question is it a problem if they stop using it when they're well? And would it make a difference if they took it regularly? And that's a really good question. It's something we do see a lot because people whose asthma is relatively mild and doesn't cause them too many problems day to day will often feel that they don't want to take a medication every day because they don't feel too unwell. And the problem with that is if people don't take their medication regularly, you can get more inflammation in the lungs and then you can build up. And most importantly, particularly for this person who's had a flare-up of their asthma, if you don't take a regular preventer, you're much more likely to have another flare-up of your asthma. You're much more likely to have another exacerbation requiring steroid tablets, or to have to go to the emergency department, or even to have to be admitted to hospital. So when someone's had a cough or a cold that's then led to an asthma exacerbation, or they've had an asthma exacerbation with no clear cause, they're much more likely to have another one in the next year, and we'd recommend that they're on a regular preventer. Nowadays, there are some combination inhalers that have a reliever and a preventer combined into one. And this person's actually on one of those. And in those situations, sometimes if your asthma is relatively mild, you can stop taking the medicine regularly and you can just use it as a reliever. But that only helps prevent flare-ups, asthma attacks, if the reliever has both a preventer and a reliever in it. So medicines that have what's called budesonide or formoterol, the most common brands in this country are Symbicort or Duo-Res Spiromax. Those have both a preventer and a reliever, so you can use them as a reliever, but you also get the top-up preventer. Standard blue inhalers, salbutamol, Ventolin, Salamol, those help with your symptoms at the time, but they don't do anything to treat the asthma. And in fact, if you overuse them, they can make the asthma worse. So if you're going to just use an inhaler intermittently, it has to be one of the newer combination inhalers if you're going to do that. So thanks for that question. Next question is, are there some alternative therapies I can use along with my asthma medicines? And that's a really interesting one because some people wish to explore complementary and alternative approaches to their health, which we're fully supportive of, in that we're here to help people do what's best for them, and so we provide the information, and then it's up to an individual what they want to do. The alternative medicine, the alternative approaches haven't been proven to work for asthma at the moment. So if somebody chooses to use one of those, the main thing that I'd say is please don't stop using your regular inhalers. Now, if somebody wants to use things like breathing techniques, as a complement alongside their inhalers, well, that actually can be really useful, and particularly breathing techniques can help reduce the feeling of breathlessness that some people get and can help people feel they're more in control of their asthma, and that's brilliant, and I'd thoroughly encourage people to do that. Some of the other herbal medications aren't proven to be safe, and if you were going to take some, I'd really encourage you to talk to your doctor or to talk to your asthma nurse about what you're thinking of taking, just to check that there's no interactions, because sometimes herbal medicines can cause problems with other medicines people are on. So there's no evidence that they work. If you are going to choose to take them, please make sure that it's not something that's going to cause problems with your other medicines. And the next question is around whether asthma is related to other chronic diseases such as rheumatism and diabetes. And I'd say there's no direct link that's going to make somebody with diabetes much more likely to get asthma. There are some complex interactions that mean that some people with multiple conditions are more likely to be diagnosed with other conditions, but there's not a direct strong link that says that if you've got one of these diseases, you're definitely going to get another. But there are some complex interplays around the edges. But generally speaking, no, the fact that somebody's got rheumatic disease or diabetes does not mean they're then going to go on to get asthma. The next question is, if I'm a mum with severe asthma, is it likely my baby will also get asthma? And the answer to that is not necessarily, but they are at slightly higher risk. So there is a genetic component to asthma, but there's also a heritability component that's also around your environment. Somebody that lives in the same household as you, is exposed to the same allergens and other things, shares some of your risk factors. So somebody who has asthma, their children are more likely to have asthma, but there's still a reasonable chance that they won't, and you can't actually predict it. So it's something to be aware of. If you notice that they have symptoms that suggest they might have asthma, it'll be worth discussing with their doctors in due course. But there's no guarantee just because you've got severe asthma that your children will have it. They might not. And even if they do have asthma, it won't necessarily be severe. And the final question we have is, why are the rates of asthma so high in New Zealand? And we'd love to know the answer to that for definite. We know that some of it is around heritability and genetic predisposition. Some of it is around allergens and environmental issues. One of the big issues as well is if you've got two countries and people shared the same underlying risk of asthma, if you then put them in a situation where they're more exposed to cold and mold and other things, then you're going to see more people with symptoms of asthma and treated asthma in the group that are exposed to those conditions. So the fact that our housing stock is quite poor in New Zealand, the fact that we don't have good insulation, that a lot of homes are cold and damp, also contributes to why we see rates of people needing treatment for their asthma, who, if they were in another environment, might still have the predisposition to have asthma, but may not actually be unwell enough to be given the label and to need medicines. So some of it is not just around our risk of asthma, but it's the fact that we're in an environment that makes us more likely to need treatment. So that's all the questions I have. I hope they're helpful. Let the foundation know if there's other questions you'd like answering. Thank you.